Hi everyone, today we'll talk about breast augmentation. Breast augmentation, as the name suggests, augmentation means to increase the size. So breast augmentation previously we used to do with the silicone implants only or saline implants, but nowadays another method is also there. We can do breast augmentation of size increase by injecting fat also. So there are two methods of breast augmentation. One is with implant, another one is by fat injection. So first we'll talk about breast augmentation with implants. So patients having small breast or hypoplastic breast, when the breast size is very small, then what we do, we insert the silicone implant underneath either the muscle or the glands. There are different criteria with which we judge whether we have to insert under muscle or under the glands. So accordingly we decide the plane and we insert the implant inside, and that's how the size of the breast is increased. So this procedure takes around 1.5 hours, and the same day the patient can go back if there are no associated comorbidities, means any other medical condition is not associated, then the patient can go home the same day. You have to avoid lifting heavy weight or strenuous exercise of arms, like means stretching your arms overhead, or playing outdoor games and lifting heavy weight. All these sorts of activity which will pull your pectoral muscle, you have to avoid for around 3 to 4 weeks, depending upon the size of implant you have got inserted. Means with the silicone implant we can increase your breast size. First we judge how much tissue is there, how much to be inserted inside, depending upon the discussion which we have with the patient. Then we decide a certain size and accordingly that is inserted, and then these post-op instructions one has to follow. And this procedure is almost, they say, around 10 to 15 years the implant lasts, but if you take precaution then 10 to 15 years, but otherwise you can have some minor complications which we discuss with the patient when the patient comes for the procedure.